This topic is more serious than most people think. Leg cramps in seniors are not just annoying, they can ruin sleep, impair walking, and even lead to dangerous falls. In the United States, thousands of older adults report waking up screaming in pain due to sharp, unpredictable muscle spasms, usually in the calves or feet. These episodes can last minutes, but leave a lingering ache for hours or even days. While many in the United Kingdom, Canada, and Australia also suffer, it's in the U.S. healthcare system where the problem often goes undiagnosed or is brushed off as a normal part of aging. It's not. And it should never be treated like it is. The truth is that nutritional deficiencies are one of the most overlooked yet correctable reasons behind chronic leg cramps, especially in the senior population. The number one vitamin seniors need to think about is magnesium. And yes, it's a mineral, but in the world of U.S. supplements, it's often sold and labeled alongside vitamins. Magnesium is a muscle relaxant. Its job is to prevent overstimulation of the muscle fibers, especially during sleep. Without enough magnesium, the calcium in your system becomes unbalanced, and your muscles start to contract when they should be at rest. That is exactly why a person can go from a deep sleep to a scream in less than a second. In the United States, many seniors are unknowingly magnesium deficient due to heavy prescription medication use, especially diuretics for blood pressure, and poor nutrient absorption from decades of gut damage. Next is vitamin D, which is not just about bones. It plays a crucial role in muscle contraction and neuromuscular function. Many seniors across Canada and the U.S. have dangerously low vitamin D levels, especially during the winter months when sunlight exposure drops and staying indoors becomes the norm. This can lead to not only weakened bones but also uncoordinated or erratic muscle movements. Studies have shown that low vitamin D is directly correlated with increased nighttime leg cramps, especially in those over 65. Supplementing with D3, the active form, is far more effective than D2. Combine that with magnesium, and you start to see real change. In some U.S. nursing homes where D3 is consistently given, reports of night cramps drop dramatically in just a few weeks. Another essential is potassium, which is deeply involved in the electric signaling of muscles. The problem in the U.S. is that potassium is tightly regulated in supplements. Pills are capped at 99 millimeters due to older FDA restrictions, which is far below the amount needed to truly make an impact. Yet most Americans don't get nearly enough potassium from food. Bananas are not enough. Potassium-rich options like avocado, spinach, sweet potatoes, and coconut water need to be consumed daily, especially by older adults, and without enough magnesium, potassium won't get into the cells efficiently. That's why even people taking potassium supplements may still cramp. It's about synergy, not isolation. Vitamin B12 is one of the most misunderstood players in this area. It's critical for nerve function. Seniors, especially in the United States and Canada, often have low B12 because of reduced stomach acid levels, which are needed to absorb it. And guess what? B12 deficiency can lead to nerve-related pain, tingling, and cramping, especially in the legs and feet. It can feel like electricity or like the muscle is twitching and won't let go. B12 in methylcobalamin form is better absorbed, especially sublingually. Seniors with chronic leg pain or tingling should have their B12 levels checked regularly, yet this test is often skipped entirely in basic primary care. In Australia, there's slightly more awareness of B12 in senior care programs, especially for those with vegetarian or vegan diets, but it's still under-addressed. Then comes calcium, which must be mentioned carefully. Too much calcium without magnesium leads to more cramping, not less. But too little calcium, especially in older women who've been told to avoid dairy or who have osteoporosis, can cause spasms and tetany, particularly at night. In the United States, calcium is often prescribed in isolation, which is a massive mistake. It should always be paired with magnesium and vitamin K2 to direct it to the bones and not the arteries. Calcium gluconate or citrate is more effective for muscle-related issues than the common calcium carbonate form, which can cause constipation and poor absorption. Seniors should never supplement blindly. Get your blood calcium and ionized calcium levels checked, especially if you're dealing with cramps, twitching, or numbness. Vitamin E has a unique role, especially in seniors dealing with circulatory issues. In older adults with peripheral artery disease or reduced circulation in the legs, a common scenario in the U.S. due to diabetes, and sedentary lifestyles, cramps can often be traced back to low oxygen delivery. Vitamin E improves microcirculation and helps reduce oxidative stress in small blood vessels. One fascinating clinical observation in Canada revealed that seniors who took mixed tocotrienols and tocopherols, the full-spectrum vitamin E complex, had fewer incidents of nighttime calf cramps, especially those also managing type 2 diabetes. It's not just about the muscle, it's about how the blood is getting to the muscle, and E helps with that. Now comes vitamin B1, also known as thiamine. Deficiency is extremely common in elderly individuals who have taken antacids for years, which reduces stomach acid and blocks absorption. In U.S. hospitals, thiamine deficiency is often only tested in extreme cases like alcoholic neuropathy, but many non-drinkers have it too, especially seniors. Symptoms include not just cramping, but fatigue, nerve tingling, and even mental fog. It is a water-soluble vitamin that gets depleted fast and needs regular replenishment. In one hospital study in the United Kingdom, thiamine injections in older adults with chronic leg pain resulted in a dramatic improvement in walking ability and reduced cramping within 2 weeks. Why is this not standard in all senior care? Folate, B9, also plays a key role. It aids red blood cell production, and when folate is low, oxygen transport suffers. In the U.S., many older adults eat low-quality processed diets with minimal leafy greens, so folate levels plummet. And here's the catch. If you're taking medications like methotrexate or certain diuretics, your folate might be getting wiped out even faster. Cramping can then become a secondary symptom of a larger anemia or oxygen delivery problem. Folic acid is the synthetic version, but methylfolate is what your body actually uses, and that form should be the standard, especially in seniors with the MTHFR gene mutation, which affects folate metabolism and is present in millions across North America. Another overlooked vitamin is vitamin C. While not directly linked to muscle contraction, it plays a key role in maintaining healthy blood vessels, collagen, and connective tissue. Chronic leg cramps in seniors often stem not just from muscle issues, but also from problems in the tendons and surrounding tissues. Vitamin C deficiency is not rare in the elderly population, especially in U.S. retirement homes with limited access to fresh fruits and vegetables. If you bruise easily, bleed from the gums, or heal slowly, vitamin C levels could be low, and that could be affecting your legs more than you think. It's also essential for iron absorption, another player in muscle function. Next up is vitamin K2, not to be confused with K1. K2 directs calcium to the bones and away from soft tissues. In U.S. seniors, there is often a buildup of calcium in the arteries and tissues, yet still a deficiency in the bones. That can lead to leg cramping, tightness, and poor circulation. K2 in the MK7 form stays in the body longer and is more effective. Few doctors in Canada or the U.S. routinely check for K2 deficiency, and yet research clearly shows it works synergistically with D3 and magnesium to prevent vascular calcification, a major contributor to muscular discomfort and cramps in older adults. Lastly, we need to talk about vitamin B6, which helps the body use amino acids and regulate nerve function. Deficiency can cause nerve irritation and twitching in the legs and feet. In Australia, where B-complex supplements are commonly used in aged care, reports of neuropathic leg pain are significantly lower in supplemented groups. In contrast, in the United States, Many seniors with B6 deficiencies are misdiagnosed with restless leg syndrome and prescribed unnecessary medications when a simple nutrient correction could reduce symptoms dramatically. Many seniors in the United States live with daily or nightly leg cramps and never realize that their multivitamin may be completely missing the nutrients that could help. The issue is not just deficiency, it's the form and the balance. For example, a typical U.S. multivitamin might include vitamin B6, but often in the form of pyridoxine hydrochloride, which must be converted in the liver to be active. Many seniors, especially those with liver issues, diabetes, or medications that slow enzyme activity, cannot perform this conversion effectively. What happens then is that the inactive form of B6 builds up and may actually cause nerve damage or worsen symptoms like tingling and burning in the legs. The active form, P5P, pyridoxal 5-phosphate, is what the body uses directly. Supplements using this form are harder to find in the U.S. pharmacy shelves, and they're almost non-existent in basic hospital settings, even though they're essential for seniors struggling with recurring leg cramps tied to nerve dysfunction. It is also crucial to understand that many seniors in the United States are prescribed medications that directly deplete essential vitamins. For instance, statins, widely used for cholesterol management, can deplete CoQ10, a compound needed for mitochondrial function in muscle cells. Without CoQ10, muscles fatigue faster, cramp easier, and recover more slowly. Yet very few doctors inform their older patients about this side effect, even though clinical research from top institutions in the U.S. and Canada has confirmed that CoQ10 supplementation significantly reduces muscle-related side effects in older adults taking statins. In fact, some seniors regain the ability to walk comfortably and sleep without cramping within a month of consistent CoQ10 use. The combination of vitamin D3, K2, magnesium, and CoQ10 forms what many integrative practitioners in the United States now call the core muscle support stack for seniors. This specific stack has been used in clinical trials and wellness centers for older adults who struggle with chronic calf cramping, thigh tightening, and post-walk soreness. What's shocking is that in many U.S. hospitals and clinics, not one of these nutrients is mentioned during a senior wellness check. Instead, patients are given muscle relaxants or told to stretch more, treating the symptom but not the cause. This neglect leads to unnecessary suffering, dangerous falls at night, and avoidable ER visits, especially when the cramping causes a senior to collapse trying to stand. Another major cause of vitamin loss in seniors in Canada, the United States, and Australia is poor gut absorption. Many older adults suffer from low stomach acid, undiagnosed celiac disease, or long-standing IBS, which interferes with the absorption of water-soluble vitamins like B1, B2, B6, B12, and folate. Seniors may be eating what appears to be a healthy diet and still be low in critical nutrients due to poor bioavailability. In fact, studies have shown that as we age, the body's ability to produce intrinsic factor, a protein needed to absorb B12, drops significantly. Without intrinsic factor, even a B12-rich diet won't be enough. Sublingual B12 and injectable forms are more reliable, and they are used regularly in Australian aged care facilities with noticeable reductions in leg-related nerve discomfort. It's also worth mentioning how electrolyte imbalance leads to cramping, especially in seniors who are dehydrated or on fluid-reducing medications. Sodium, potassium, magnesium, and calcium all work in delicate balance to keep muscles contracting and relaxing smoothly. In the United States, seniors are often told to drink more water but are not told about electrolyte replacement. If you drink water alone, you dilute the already low levels of sodium and potassium in the bloodstream, which makes cramping worse. Many people experience worsening cramps not because they're dehydrated, but because their electrolytes are off. This is especially common during hot summer months in southern U.S. states, where seniors lose salt through sweat but don't replenish it adequately. Simple solutions like electrolyte powders, Potassium-rich broths or magnesium sprays can offer immediate relief when used properly. Vitamin B2, riboflavin, though not often talked about, is critical for energy production at the cellular level. It's a key cofactor in the electron transport chain that powers muscle cells. Seniors who are low in B2 often report muscle weakness, soreness, and a burning sensation in the legs after walking. This isn't just fatigue, it's mitochondrial dysfunction. A study in older Canadian women with chronic fatigue and leg cramping found that B2, when supplemented along with B1 and magnesium, improved energy and muscle coordination within 3 weeks. This combination isn't available in standard U.S. multivitamins, which often use poor-quality B-complex blends that do little to restore actual deficiency. Another important piece is iron, especially in older women. Anemia is incredibly common in postmenopausal women in the United States and Canada, and one of the symptoms, besides fatigue and pale skin, is cramping in the legs. This is because iron is essential for delivering oxygen to muscle tissues. Without enough iron, muscles operate in an anaerobic state, leading to lactic acid buildup, soreness, and nighttime spasms. But supplementing iron without testing is dangerous, especially in men and older adults, where too much iron can cause toxicity. That's why a full iron panel, not just hemoglobin, is crucial in evaluating leg cramps. In Australia, full iron panels are more commonly run in geriatric patients than in U.S. clinics, where only basic CBC panels are often ordered, which don't show the whole picture. It's also crucial to mention that vitamin A, though fat-soluble and stored in the body, is still essential for maintaining proper nerve insulation. In elderly people with suboptimal vitamin A levels, often those who eat very little fat or have been on low-fat diets for decades, nerve signals slow down. This can manifest as weakness, tingling, and even cramping during activity or sleep. Vitamin A toxicity is possible if over-supplemented, but when balanced with D and K2, it can restore normal nerve and muscle interaction in ways most seniors never get to experience. Retinol form, not beta-carotene, is the one seniors need, especially in those with thyroid issues or diabetes, which impair beta-carotene conversion. There is also a direct link between omega-3 fatty acids and reduced inflammation in muscle and nerve tissues. Seniors in the United States and Canada often consume too many omega-6 fats from processed foods, leading to chronic inflammation in the legs. This inflammation disrupts normal blood flow, compresses nerve endings, and contributes to tight, cramping muscles. In contrast, older adults who consume fish oil or algae-based omega-3s regularly experience fewer cramps, less soreness after walking, and more stable circulation. Clinical trials show omega-3s also improve the effectiveness of magnesium and vitamin D in the body, making them more than just anti-inflammatory. They're synergistic with other nutrients that prevent cramping. Taurine, while not a vitamin, is an amino acid that plays a vital role in calcium signaling in muscle cells. Deficiency in taurine can lead to excessive calcium buildup inside the muscle, leading to spasms. In elderly people with congestive heart failure or chronic kidney disease, common in U.S. seniors, taurine deficiency is nearly universal, yet very few are ever tested for it. Supplementing taurine in these individuals, even at low doses, often leads to a dramatic drop in cramping frequency and intensity. In some Canadian geriatric wards, taurine is quietly being reintroduced in supplement protocols for older patients with leg pain and poor muscle endurance. In many cases, it's not about just taking one vitamin. Seniors need the correct forms, in the correct ratios, in a body that can absorb them. And it's here where the United States healthcare system continues to fail its elderly population. Instead of routine micronutrient testing, seniors are given prescriptions for muscle relaxants, sleeping pills, or told to take a multivitamin that barely covers the minimum. There are seniors out there who can't sleep, who can't walk, who live in fear of waking up with unbearable leg cramps every night. Some are stuck in cycles of fear, pain, and hopelessness, just because no one checked their B12, magnesium, or vitamin D levels. Others have been labeled with fibromyalgia or restless legs syndrome, when the real issue is a cascade of nutritional imbalances caused by decades of poor diet, aging, and medication side effects. Many people cry themselves to sleep or can't sleep at all because their legs are jerking, cramping, or feel like they're on fire. You have to ask, has their doctor even run a full nutrient panel? In most U.S. clinics, that answer is no. Instead, older adults are dismissed or told to do calf stretches and drink more water. It's not enough. Seniors deserve better. Seniors in the United Kingdom, where there's slightly more awareness of nutritional support in aged care, still struggle. But at least the conversation is happening. In the U.S., we're still years behind in understanding just how critical vitamins and minerals are for muscle health in the elderly.